Hi, I'm here to talk to UGA students today about Ambien and Ambien addiction. Ambien is the name of a prescription medication sold in the United States. The name of the drug inside the medication is zolpidem, and this medication is known as a sedative hypnotic, which means that this medication is used to treat sleep disorders, most commonly used to treat insomnia. This medication needs to be used properly. It needs to be used under the supervision of a healthcare professional, most likely a family doctor or a primary care provider. Typically, this is taken as one 10 milligram tablet every night, although other doses do exist. It is really important for this medication to not take this medication for longer than 35 days, and this is due to tolerance and dependence that will set in. Um, and due to this tolerance and dependence, it is necessarily to talk to your doctor if results aren't seen in 7 to 10 days, because otherwise the medication is not working and there's this addictive nature of the medication, and another medication should be chosen in that situation. There are a number of side effects seen with Ambien. The number one side effect seen is tolerance. So after a certain period of time, whoever's taking it might realize that it's not helping them anymore, and this can goes along with it's not helping them anymore, but they also can't not take it because otherwise they won't be able to fall asleep. Um, a lot of the other side effects are kind of similar to heavy alcohol consumption, which includes sedation, loss of motor control, memory impairment. There's also feelings of euphoria, hallucinations, and sleepwalking. And all of these side effects can combine to really cause some abuse potential for this medication. A lot of people will take it trying to almost get drunk in a way without a hangover. They might take it to feel euphoric or feel for the hallucinations. Um, and there's also the serious side effect of sleepwalking. That side effect can really be dangerous. People can sleepwalk into traffic. People have sleepwalked off of bridges, and people have really gotten hurt that way. Um, a lot of people will abuse that medication, and there are side effects of abusing this medication. A lot of times people will take it for longer than recommended, or they will take multiple doses at one time, and this will lead to tolerance as well as dependence, which can really cause some serious effects. Um, it's really a problem if someone needs a drug in order to fall asleep, and we want to try and avoid that if possible. Abusing Ambien can also lead to blackouts and amnesia, as well as memory issues, which for students can really lead to some issues with grades. There's also the risk of overdose with this medication. It's possible to overdose with this, but a lot of times it's seen in combination with other depressants. So after a heavy night of drinking, someone might decide they really need to sleep off that hangover that's coming up, and they might take 4 or 5 Ambien at a time. And that combination of alcohol and Ambien can really be deadly in some situations. So it is really important to remember that this medication is addictive, and addiction with this can set in as early as 2 weeks. Um, but if you go back, we said that this medication may be taken up to a max of 35 days. So a lot of times prescribers will write for a 30-day supply of this, um, and which can lead to some serious addiction because that quantity of medication that's given to them can lead to addiction. It's also important to note that taking higher doses than prescribed can lead to addiction, as well as using this without a prescription. And a lot of the times people will take this medication normally, they'll get a 30-day supply, and it's used to treat a short-term episode. But by the end of those 30 days, addiction can set in as early as 2 weeks. So by the end of those 30 days, they might be fully dependent on that medication to fall asleep. Some signs of abuse include the inability to fall asleep without this medication. Cravings will start to set in. Sometimes people get really irritable. They get really angry easily. They kind of withdraw from themselves. They withdraw from friendships. They just kind of keep to themselves. Another sign of abuse is memory loss and impairment, and this one can really affect students. It's kind of hard on students when you've been studying really hard for a test, and because of the Ambien, you're sitting there at your test and just having a really hard time remembering what you just studied, and that can really lead to some consequences on grades. And there's also withdrawal symptoms. So once you stop taking this medication, some signs of abuse, like all those other ones will pop up. So it'll be all the cravings, the withdrawal, the irritability, all those withdrawal symptoms will set in. So there are a number of risk groups. There are a number of groups of people who are at risk, and one of those groups is the elderly. Due to the natural aging process, it's harder for the elderly to fall asleep, so they are prescribed this medication more. Sometimes night workers are prescribed this medication to help them fall asleep during the day. Same is seen with shift workers. And because this work is ongoing, sometimes they get this medication for a long period of time, and that can lead to Ambien addiction. Pregnancy can also lead to insomnia, so sometimes pregnant mothers are given Ambien, and students. Students are at a risk group for Ambien addiction due to the stress of school sometimes, keeping students awake at night, and then they'll get a Ambien prescription for 30 days, and then tolerance will set in at 2 weeks, and that's really a situation that we want to avoid. So it's really important to remember if you see any of those signs of abuse or you're seeing any of those adverse effects, there's nothing wrong with recognizing there's a problem and reaching out for the help that you really need. You can always talk to your doctor, you can always talk to your pharmacist, or if you don't want to talk to someone face-to-face, there's also a number of hotlines available. Drugabuse.com has a great hotline, and if an overdose is suspected, then Poison Control really has individuals that are trained to help with those situations. So the takeaway message is only use this medication when prescribed, only use it for short-term use because this is not intended as a long-term treatment for insomnia, and really try and treat the underlying cause, which includes managing stress, using time management skills to keep the coursework under check, and really try and treat the root cause. So try improving sleep hygiene, which means sleep in a dark room, really get a consistent sleep schedule, try and sleep for 8 hours a night, and really try and turn off screens an hour before going to bed. So thank you very much. These are our references. Enjoy the rest of your day.